The pandemic's impacts have been felt in every family and community, bringing new challenges and also magnifying existing issues and concerns. Now we're finishing the second full year in this pandemic, and COVID-19 Vaccine Education and Equity Project is working to continue educating and bringing awareness about vaccines and health inequities. Schroeder Stribling, President and CEO of Mental Health America, joins us this morning to talk more about this. Good morning, Schroeder. Thanks for joining us.
Good morning. Thanks for having me.
Yeah, absolutely. So first, let's talk about what the project is, the COVID-19 Vaccine Education and Equity Project.
The COVID Vaccine Education and Equity Project has a goal of making sure that everyone has the information that they want and that they need about vaccinations. There's a lot to know, and there's also been a lot of misinformation or a variety of sources that people may be listening to. So the project really aims to get as much information out there so people can make the best informed health decisions for themselves.
Yeah, with this misinformation, are you seeing it more in certain communities than others? And is this potentially highlighting even more disparities?
I'm not sure that the misinformation is different in different communities. I guess what I would say is that it's most important to listen to the central sources of science that we know are providing updated guidance for us. So, for instance, guidance from the CDC, which is updated at cdc.gov/COVID-19, is a great place to get all of the updated news and information as we go along.
We know that a lot of people may be having fatigue with listening about this pandemic, but that fatigue may also be turning to stress and anxiety, and everyone's dealing with it differently. How is the project really addressing the mental health impact?
You're asking a great question, and it's something that we at Mental Health America have been very focused on. We really see there is a mental health pandemic twinned with the COVID-19 pandemic. Many of us, all of us, have experienced some amount of distress because of all the disruption in our lives and all the changes, from all the disruptions for school children and for parents and for workers and for essential workers. There have been so many ways in which we have felt stress, isolation, fear, loneliness. These are very normal responses. And there are, as you mentioned, a few things that we can do about those normal responses to try to help ourselves and our loved ones and our communities. One of them, as you noted, is sometimes maybe taking a break from absorbing all the news about the pandemic. Other things include the basics like taking care of your body, getting adequate rest, exercise, eating well. Some of it is also about talking with trusted others and finding sources of support. And for people who find themselves in crisis, there are also ways to get assistance immediately, either through the National Helpline or by coming to Mental Health America at mhanational.org. You can find help and resources there.
What are some important things to continue remembering when we are talking about focusing on ourselves? I know you mentioned a little bit of working out and movement, things like that.
Certainly, those self-care options are really important, and they're available and accessible to everyone. And we recommend that in addition to checking in with yourself, and you can do so at MHA's website with a screening, also check in on your loved ones and ask how they're doing during this. And try to connect, even though we're distancing in so many ways and we've become accustomed to using Zoom or connecting digitally, it's still a way of connecting.
One more time, the website for Mental Health America
is www.mhanational.org.
Okay, perfect. Thank you so much. We appreciate your time this morning. Thanks for joining us.
Thank you.